Dear rehabilitation stakeholders, my name is Dr. Joseph Mwangi Madheri, Head of the Department of Rehabilitation Sciences at Jomo Kenyatta University of Agriculture and Technology. Our university pioneered and still runs ahead in the training and rehabilitation professionals at undergraduate degree levels for physiotherapists and occupational therapists. We are also excited to be the leaders in training for Master of Science in degree programs in orthopedics, neuro rehab, and sports physiotherapy. Our department, with the relentless support of the university administration, is working strategically to expand training of rehabilitation professionals to include prosthetics and orthotics, dental technology, exercise and sports science, as well as being the host of medical social work training. We will also be happy to launch the master's degree programs in the areas I've just mentioned. Working with Kenya Scoliosis Foundation, as we are experiencing this for the second year running, is one of our strategic achievements in our endeavor to collaborate and to keep connected to patients-based organizations. Ladies and gentlemen, training and rehabilitation of experts without a deep touch into patients' experiences and an exchange of ideas towards identification of researchable problems and their involvement in scientific methods of deriving solutions is not a 21st century approach to rehabilitation. It is on this realization, ladies and gentlemen, that our collaboration with Kenya Scoliosis Foundation is growing stronger with an aim to expanding the scope of research in rehabilitation of those with spinal health challenges and building capacity of rehab professionals to have better outcomes. Kenya Scoliosis Foundation, with support from a wide range of well-wishing partners, indeed is committed to strengthen these two pillars, that is, research and capacity building, to enable quality healthcare delivery. Colleagues, even as we scratch the ground in our country, Kenya, fellow professionals have gone ahead to lay foundations for scientific work in this area. I will today cite Abraham Coates-Dutoit in South Africa, who recently studied current knowledge on idiopathic scoliosis among practicing physiotherapists in South Africa. Part of the study, and important to note, is that the study identified that more than 50% of physios could not define scoliosis correctly. This is obviously having implications on care. Further, as recent as last year, 2019, Berger and colleagues still in South Africa reviewed literature on the effectiveness of the scratch exercises in adolescents with idiopathic scoliosis. What did they find? The results are amazing. and worth saying and paying attention to as rehab professionals here in Kenya. This would be only possible if we give evidence-based practice opportunity during our day-to-day experiences. Kakamo and colleagues in CHILD have also emphasized that early detection and use of objective measurements, as they are key to mitigating of adverse effects and bettering quality of life. Kakamo et al. Study unearthed significant prevalence of scoliosis exists among school-going children. Truly, food for thought this is for our country and beyond, and should inform the strategic directions we take when we seek to conduct research among our populations. As a country and rehab stakeholders, we remain open to learning and improving our skills. We also are keen to share experiences from the able speakers in this colloquium that would further enable policy development and adjustment of our healthcare systems for better outcomes of those with spinal challenges. At this juncture, I would wish to thank the leadership of Kenya Scoliosis Foundation for this partnership, and on behalf of JKUAT, that is Jomo Kenyatta University of Technology, commit to continue this relationship to greater heights. Thank you and welcome and enjoy having this interactive sessions within the colloquium. Thank you very much. Welcome.